Hello, I am Dr. Jyoti Bajpai Dikshit. I am a genetic counselor at Karkinos Healthcare. Today, we are delighted to have Dr. Yogesh Jain with us. Dr. Yogesh Jain is a public health physician with an MD in pediatrics from All India Institute of Medical Sciences, New Delhi. He is the co-founder of Jana Swasth Sahyog, a people's health support group, and Sangwari, People Council for Equity and Health. Both are the community health programs that serve rural Chhattisgarh. His work serves people in over 3,500 of the most marginalized villages. At Karkinos, Dr. Yogesh Jain provides his expertise in public health, particularly focusing on rural healthcare challenges and access to cancer care. His experience in community health and advocacy for equitable healthcare aligns with the Karkinos' mission to make cancer care accessible and affordable and available to underserved populations, especially in rural areas. Welcome, Dr. Yogesh.
Thanks. Yeah.
Dr. Yogesh, cancer is becoming a bigger challenge worldwide day in and day out. Hence, it is important to understand how the cost of cancer care affects both individuals and healthcare systems. Prevention, early detection, and also how it impacts society overall and its implications on public health and the general population.
Cancer care is actually characterized, as we would say, by a significant burden, financial burden on the people who suffer with these illnesses and their families. They incur, high out-of-pocket expenditure. But also the other thing that we see is that, the people, for the fear of incurring such large expenditure, they deny care to themselves or to suffer, inadequate or poor quality care seems to be now the dominant pattern. The poor people suffer far more than the people who are not so poor, and also people who are geographically, further away from major centers of healthcare in cancer. They suffer far more financial burden of cancer care, and this really would need to be handled by what I can call as universal healthcare that people should have a right towards. And obviously, one other thing that we need to ensure, such a prevention of such major consequences on the economy of people is to have early diagnosis through screening programs, which would, when the cancer is curable and more and cheaper to treat, that would be the stage at which how I would want health systems to be geared towards to handle impact of cancer care.
Thank you, Dr. Yogesh. As you said, prevention may help. Preventive healthcare, it plays a key role in reducing the risk of diseases and promoting overall well-being. Healthy lifestyle, regular screening, and proactive action are a few ways by which individuals can stay healthy and avoid the high cost of treatments later. What foundational steps can our listeners take to achieve a healthy balance in preventive healthcare for cancers?
As you point out, prevention is clearly superior to therapy in cancer care, if not in other, also in other, types of illnesses. So whether it is talking about, health determinants like tobacco or alcohol, which are directly related to many cancers that we see in India, avoiding both, chewable tobacco as well as smoking tobacco would result in clearly, reduction in cancer incidence, as well as, and if it is coupled with screening programs for such cancers that are due to these addictions, tobacco and alcohol, would reduce the cost of care as well as reduce the incidence of these cancers. Besides this, I think a major way to prevent cancers in the future would be those cancers that are related to obesity and overweight, which are several, particularly the GI cancers that we know about, So a healthy lifestyle that is including, some form of exercises regularly and cutting down on empty calories to prevent obesity from happening would be my third suggestion for preventive aspects of cancer care, as well as, we now have the provision for vaccines for at least one cancer, the cancer cervix. But I think something that would be, if it is available for all our adolescent girls as well as boys, that would reduce the occurrence of this major cancer, but that whose results would show up in next 15 to 20 years. Until then, we could combine it with screening programs, universal screening programs from an abysmal situation of 3% that we are doing at the moment. If we can do a universal screening for cancers particularly the cervix in women, as well as breast cancer, but also oral cancer screening, if we can do besides some other cancers that can also be screened, and then cheaper care and earlier care and more effective care be provided, that would really result in reducing the financial burden of cancers by preventing cancers as well as by treating them early.
Thank you, Dr. Yogesh. We would like to hear your experience about Sangwari or whatever is being done in Chhattisgarh. How has it helped in treating the patients or preventing the cancer?
So I think at some level, our work has been able to influence care, one by having screening programs effectively being delivered at a community level, so as to lead to early diagnosis of some cancers that we can pick up. The second has been that we are also able to provide distributed cancer care by providing cancer chemotherapy as well as diagnostic procedures closer to people's homes without referring them to major city hospitals which would have been clearly more expensive. That is the second way. And the third is largely by providing effective palliative care at the community level, where or at people's homes, which have been clearly shown to sort of reduce misery while seeking care at advanced stages of when the cancer is little advanced, would be the third major way that we've been able to support patients with cancer.
Thank you so much for enlightening us with the information as well as with the example of Chhattisgarh and its impact on both public health systems as well as on individuals, and also highlighting the importance of early prevention and intervention so that the costs can be reduced. Thank you for educating us on how, by focusing on prevention, we can improve health outcomes for cancer patients and also reduce the economic burden on society, which is being caused because of cancer disease. Thank you very much, Dr. Yogesh.